I am Olivia Nass, and I am 19 years old.
Tell us a little bit about yourself.
So I go to college at the University of St. Thomas. Before college, I played volleyball, and I like to think of myself as pretty athletic. I work out, I like to hang out with my friends, I like to do anything a normal teenager would do. So as I developed scoliosis, I had absolutely no idea. We actually had a screening at my school in 5th grade, and the night before my mom said, you're probably going to have it since I have it. And so that was kind of when I found out before the screening, and then I knew after the screening. I had surgery a year and a half ago, so in December of 2018, and it's kind of just been history since then.
What concerns did you have when you learned you had scoliosis?
I had a lot of fears, so I went to a normal doctor before I actually went up to Gillette's, and I was just scared that I was going to have to get a brace and how my life was going to change and how people were going to see me or view me, but I realized that it didn't really matter in the end. I think I just wanted to be able to look normal. I mean, I was scared of people like bumping into me and then finding out I had a brace on because it was very hard, and so I was just always nervous about that.
What concerns did you have when you thought about surgery?
I guess I was just nervous of something going wrong. I don't know what would have gone wrong, but there's always just that nervousness that something will happen and then my mom won't know what to do, but nothing like that happened, so.
What do you remember about your surgery experience?
Right before my surgery, I remember being very anxious, very nervous, but the doctors at Gillette's were able to calm my nerves and just help me think about something other than surgery. And it really all just happened so fast that at this point it wasn't a big deal and there was no need to be nervous. So they really helped to make me feel comfortable and at home. The nurses at Gillette's are very sweet. They're very kind and thoughtful of your every needs, and they also have dogs that come in and they help lift your spirits a lot, so that was nice.
What was it like when you got home?
Home, the pain was kind of worse than it was at the hospital. It took me a little bit to find out what comfortable positions there were to sit in or to lay in, and how to kind of deal with transitioning from the hospital, being looked at and cared for 24/7 to having my mom. But yeah, the first couple weeks after surgery were very tough, very difficult to get through. But then after about 2 to 3 weeks, I felt better and I was able to hang out with people and just kind of go back to a little bit of normalcy.
What helped you cope with that initial discomfort?
I had a pillow that was like a memory foam pillow, and I carried that thing with me everywhere. And it just helped with supporting me and something more comfortable to lay my back on because your back is very sore. And so that helped me to go to school, to just sit around the house. It was kind of a lifesaver.
What was it like adjusting to the rods?
It's weird. I don't know. It's just like immediately as I woke up, I figured out that, okay, yeah, my ribs have moved. Okay, my entire body has kind of moved. Like, even Dr. Gilm at one point was like, I mean, yeah, your entire insides have shifted. And then even when we got the x-rays, you could tell that like my ribs had moved and my shoulders were more even. So the first couple weeks after, once I got off of pain meds, I could really feel the rods in my back. It was just very uncomfortable. Like, I would cry myself to sleep because I'm like, Mom, I hate this feeling. I can't get used to it, but I did. And now it's just a normal, everyday thing. But I think it helped once it started fusing more and growing together, so.
What is your life like now?
So it definitely gets a little bit to get used to having rods in your back. It's a different feeling and you have to get used to having something new in your body. But after like a month or two, you get used to them and you learn how to move around them and move with them, and you learn the limits that your body has along the way, and you test them once in a while. A couple months after surgery, once I got the okay to work out, I started to because I was active before and I was working out before, and that was something that I needed to do to make myself feel better. And so once I started working out, I realized I can move, I can lift, I can do pretty much everything I could do before. And you just learn that you can do whatever you wanted to do and everything is fine.
Do you have advice for someone who's thinking about spine surgery?
It's bad, it's gonna sound weird, but you're on a lot of pain meds and constipation is a really big problem. And so if you can take precautions like immediately, it'll help you down the road. I would say that once you find out you have surgery, don't be afraid about it. It's gonna be in the future, so just live your life how you're living it now. Realize that it's what's best for you, and that although the first couple months after surgery are tough, it gets better and you get back to normal.